Welcome to the Interprofessional Space podcast, where the spirit of inquiry meets healthcare collaboration. In our podcast, we discuss all things interprofessional education. According to the World Health Organization, interprofessional education is when students from at least two healthcare professions learn about, from, and with each other to improve health outcomes and enable effective collaboration.
Dr. Joseph Zorek is an executive director and tenured full professor at the University of Texas Health Science Center at San Antonio, where he leads the award-winning Quality Enhancement Plan, Linking Interprofessional Networks for Collaboration, or LINC. He is a residency-trained, board-certified clinical pharmacist with expertise in geriatric pharmacotherapy and interprofessional practice and education. A nationally recognized author and researcher, Joe's publications include an IPE-focused pharmacy textbook, 2 national IPE consensus guidelines, and over 50 peer-reviewed manuscripts. He also developed IPE survey instruments that are used worldwide. His work as a clinician, researcher, and organizational leader has been recognized with numerous awards and over 70 invited presentations. He currently serves as the co-editor-in-chief of the Journal of Interprofessional Education and Practice.
Thank you so much for joining us today, Joe. So today we're going to really delve deep into a book that you published not too long ago called Interprofessional Practice and Pharmacy, featuring illustrated case studies. And we want to find out a little bit more just about the overview of the book, but we're going to start about talking about part of it. But do you want to give us a brief discussion around kind of what your inspiration for the book was?
Absolutely. Oh, no, I would love to. The book was created for a course that I taught at the University of Wisconsin for first-year pharmacy students. And the course was called Pathways in Pharmacy Practice. And really, it drew upon my own life experiences where I changed careers in my 20s. I was a high school teacher and then decided to become a pharmacist. And at the time, I did so much research what you can do, like on your own, not being in a profession. And it's hilarious in hindsight how little I knew about pharmacy when I made this major life decision. And so I went through this entire process of like becoming a pharmacist and trying to figure everything I could out about this profession. And I realized this wasn't really part of curricula anywhere. And so at Wisconsin, I worked with leaders in our division to create this new course. The idea being we would introduce incoming students just to the breadth of the profession and all of the different opportunities. And we would do that in their first semester of their first year so that they would then have the time to kind of customize their educational experience to prepare them for the variety of pathways that exist for PharmDs. And so that was really the idea. And when I built the course, there really was no textbook. There was no roadmap for this. And so the course got off the ground. Students loved it, very well received. But I knew that we needed some kind of like I'm a little bit old school. Like I felt like we needed a textbook to ground the course versus just posting articles, a variety of different articles every week. And so the impetus for the book was really about pharmacy and pharmacists and how to become a pharmacist. And so at the same time, my area of expertise was developing and growing in the interprofessional space. And so we came up with this idea to build illustrated cases. And this was inspired by my children at the time who loved graphic novels. And so, and I thought, wow, what a cool thing to kind of enliven the way we teach in this case study method. And so found an artist, George Foles, this amazing creative soul. And we basically went about building cases demonstrating the role of pharmacists in a whole host of different situations. And then later, once McGraw-Hill expressed interest in publishing it, we really, at that point, layered in more of the interprofessional flavor into the writing and the works that we were citing and how we built the chapters out.
I must say it's very engaging. It's one of those books you can put up and then all of a sudden you've read, like 30 pages and you're like, oh, I just felt like I just picked it up. And it's wonderful. It's really accessible too, I think, for, a lot of different levels of people. And, to find out like all the information about pharmacy and how they're engaging. So I know we're going to talk about some specific examples now. And I think Anne's got the first one ready for us.
Right. Hi, Joe. So glad that you're here today. I agree with everything Susie said. I love this book. I really felt like, as I was the first time diving into it, I was really impressed with all of it, but in particular, the write-ups after really contribute and really, as Susie said, you don't have to be a fourth semester or, near graduation student to draw from this and be able to understand and sort of apply it. I just thought it was fantastic. So we thought we would start off talking about some specific images, and I wanted to start with one. It's figure 10-11 called One Day, and the image that we're looking at is between two pharmacists, and it looks like they're trying to hand off between shifts when you see that there's a code being called. And what I really like about this is that this one image, first of all, it's so real. It's so real. It's preceded by a series of images that show things like the pharmacist doing a bedside medication history with the patient, collaborating interprofessionally with someone who's a team who's trying to decide whether a medication is appropriate for a patient experiencing a stroke. Pharmacist being stopped in the hall randomly by a physician's assistant wanting to quick question kind of thing. And then that pharmacist began their day, it's called One Day, doing a presentation about automated dispensing cabinets for the facility and why that would be a good move. And, I almost would take first semester nursing students as a nursing faculty and have them look at that series in itself, because it shines so much light on the amazing work that pharmacists do that many of us just don't know. We're just not aware of it. Can you talk a little bit about that series and that image?
Sure. Yeah. And I believe that was from the emergency medicine chapter. Mm-hmm. But it's incredible what pharmacists are doing in emergency care situations. And I think the image that you were drawn to, this kind of handoff, we were really just trying to show, and again, it was like all of these were snapshots in time of a single shift of an emergency medicine pharmacist getting pulled in lots of different directions and lending their expertise to good decision making and hopefully good outcomes. And one of the things when I was working with the authors of that chapter, we really wanted to highlight the draw of, not necessarily adrenaline or adrenaline junkies, that kind of thing. Mm-hmm. But the emergency department is a hectic, fast-paced, sometimes chaotic space. And there are certain types of people who are drawn to that and who love that. And so we wanted to capture in that story the wide variety and the pace that pharmacists are experiencing in that situation. The handoff that you shared, that was one of the conclusion of that case. We really wanted to demonstrate that like it requires teamwork, not just across professions or disciplines, like pharmacy helping decision making of the PA or of the physician or of the neurologist for that matter, but also coordinating with nurses and that kind of thing. But it also requires really strong teamwork and coordination just within pharmacy itself, because you're just one person in a complex system and your shift ends and you leave, and you have to have some mechanism to quickly bring up the person who's coming to take your spot, to bring them up to speed. And so we wanted to end the case with a handoff situation, but also that handoff taking place while a code was being called, again, to kind of reinforce this hectic, fast-paced nature of practice in the setting.
Absolutely.
And can I add one thing real quick?
Sure. Yeah, of course.
I really love that, Susie, I think it was you who mentioned, or maybe it was you, Anne, I'm sorry, the the essays that we wrote as companion pieces to each case. We felt like that was really important to contextualize all of this for for early learners. But the idea, and that you might take this case and use it with nursing students, we actually wrote that. Like McGraw-Hill asked us to identify who are the target audiences for this resource.
Yep.
And obviously it was students in high school or college who are looking for to figure out what is pharmacy, should they choose this career. It was for early pharmacy students, early in their pharmacy school careers, to sort of get the kind of understanding around the profession that they might need to customize their education. But importantly, it was also meant to be a tool that other faculty from other professions could leverage to show their students what is it that pharmacy does or is capable of. Because there are a lot of like nursing programs, for example, that do not exist on a health science campus. So, to get exposure, even if it's not face to face, and maybe it's a little bit more, academic, but at least to be able to get some exposure to pharmacy for students in that regard, I think is really important.
I agree. And I think I've recommended this book to the faculty member who teaches our PATHO Pharm course. And writing case studies is challenging, because what pieces do you include? What do you need? What's too much? Because you don't lose the students if you give them, someone's real story. There's way too much info in there. But I think these are a great point, and it's the voice of the pharmacist that you provide that, I don't have that perspective. So I absolutely see this being usable by faculty in other professions with their healthcare students.
Well, I love that. Susie, were you going to say something?
Yes. So I was. I just wanted to say that I think the assumption is very often, and we talk about in our first year, what are your assumptions about the professions, is that the pharmacist sits at a pharmacy, independent from everything. And even if they're at a hospital, it's like a pharmacy within the hospital, and they're just there and they just do prescriptions, and that's kind of it. And I think of the quiet pharmacist sort of off on their own, not engaged in the wider team, especially when people talk about emergency medicine. Very rarely would the pharmacist ever come up as like this really integral part of the team that must be there, must be a part of it, because you're dispensing medicine very rapidly to people, and you need to, have that information. You need a pharmacist there. I think, but it just isn't a part of the conversation. I think it was it's wonderful. I'm definitely going to use this this coming year with my students. So yeah,
that's incredible.
Yeah.
So another image is 13.6. It's from the chapter called Innovator, and what we're looking at this time is a pharmacist who's on the phone with an MD, and they're looking at data coming in from someone's PD watch. Can you just clarify for us what a PD watch is, Joe?
That was a little bit of a blend of new technology, monitoring movements of patients with Parkinson's disease.
Okay. So
and in some of it, I believe there is a company that was developing a product. I'm not sure where that went, but we were sort of inspired by, and again, I don't remember the exact time course, but like wearables and the sort of potential of wearables to contribute to overall health and decision making. We wanted to capture that, and of course, like I think Apple Watches were already out, but the applications to health were limited when we were developing this case. So we really wanted to just sort of introduce this idea that we could leverage technology to improve the work of the pharmacists, the work of the physicians, the patient's quality of life. Yeah,
absolutely. Because so in this image, the pharmacist is they're monitoring the symptom monitoring, and also med management. And prior to the person maybe having a fall or having some reason to go seek acute care. So just this quality of life that you talked about, and also optimizing health at home as much as possible. I was really impressed with that particular image.
It's funny too. These images, they start to date themselves in ways you can never predict. Like, I believe, that the character there has headphones on with wires.
Yep.
Which, so clearly we know that this came out before
Right.
AirPods became a really big thing.
Now it's only because the person needed to charge their AirPods. And
oh, yeah, exactly.
That's the backup, right? We all have that backup set.
That particular case that you mentioned, Anne, I think it's important to note, we haven't really talked about the applicability of these images for even patient education or family education. Mm-hmm. But I will note, so we did I'm not a huge social media, I don't know what the right word is even. It shows my engagement with social media. I'm not super active on social media, but I did in honor of I believe it was 2 years ago, and sort of like to contribute to Interprofessional Healthcare Month, sponsored by the National Academies of Practice. Mm-hmm. I did a series of posts that month. I think it was April of 23, maybe. But essentially, we were trying to just share single images that we thought were interesting with some brief explanations. And I had someone reach out to me after it, right before you get to that image where we've discussed where the pharmacist is sort of reading the output from this watch and calling a physician to make an intervention. Preceding that, there's an image where a married couple, the patient, the spouse who has Parkinson's is leaving the house, and her spouse is saying, please, you remember to put on your watch before you leave. We posted that image, and I had someone reach out to me to say, this nearly brought me to tears, because my father was recently diagnosed with Parkinson's. We are scouring the web and resources and meeting with every specialist we can, trying to figure out are there novel drug therapies? Are there technologies can we do surgeries? Like, what can we do to mitigate this health condition, the impacts of this health condition on quality of life and just longevity? And so what I'm reminded of with these cases and this way of communicating is a picture truly does convey much more than you could even imagine, because whoever is seeing the images, they're interpreting it from their own background and perspectives and experiences. And so there's just so much rich meaning that comes through this media. And that's really special. And it was also one of the reasons we chose it, or we built it for this book for the first year students in pharmacy, going back to that primary audience. Just the idea that reading about emergency medicine, reading about pharmacists in substance use disorder clinics or pain clinics or whatever, that's one thing. But to truly get a sense of is this what I want? You almost have to be able to picture yourself in there. And so we wanted to provide a visual that could spark that kind of internal dialogue, if that makes any sense. So I feel like the images really hit home in a way that we can't sometimes even predict. But the potential for us to leverage this to educate patients and families and tell stories that are meaningful from that regard is really, really high.
Agreed. And it's interesting that you reference the social media post, because our last image that I just sort of wanted us to start out with is 12-5, and the title of it is Gasping. And that I saw that first image, and what it shows is the individual on the couch, Looks like there's alcohol involved, but there had, in the previous images, had been some medication sharing, and the person's roommate is desperately trying to get them to breathe. Can you hear me? Wake up, breathe. And that, I remember seeing that image on social media. So that's what drew me to this book in the first place, because it does, the things that move our hearts and really they last, don't they? And they can inspire us to do things. So that was a very powerful series, but that one image that you showed really drew me in.
Wow, I do hear that quite a bit. That particular case, gasping, that was in our mental health chapter, I believe. Cody Wenther at the University of Wisconsin, who was the co-author for that case, is super creative and intelligent. And what we did in that case, sort of the story that leads up to the, real negative, it's uncertain what happens to this character. Like, does he die? Were the paramedics called in time? That kind of thing. But the story leading up to that eventual outcome highlights some incredible, even just knowledge that students can gain about the use of opioids and how, tolerance can develop. Because really what happened with this patient was that he was addicted and was overusing opioids for a stretch of his life, and then went through a recovery period. Which is often, very positive, of course. And then what happened is he had an injury, and he essentially wanted to sort of handle some of the pain from this injury, not really knowing that your body sort of resets itself from a tolerance standpoint after some time. And so took some opioids at the dosages that he was accustomed to previously. And that's what led to the overdose. And so, it's a credit to Cody Wenther's creativity to sort of work in the pharmacokinetics and pharmacodynamics of how the impact that opioids have on the body, and how that could oftentimes lead to these sort of negative outcomes. But no, that case, clearly that image touches people. And I think it sort of strikes at the heart of, we're living through I don't know if it's unprecedented, but it's quite, if it's not unprecedented, it's close. A long-standing crisis, in America. And so I think it struck a chord, because I think similar to, I think we're going to talk a little bit about a dementia caregiving related case later on that we published in the New England Journal of Medicine. That struck a chord because so many people are living that story. I think similarly for gasping, there's so many people who can relate. They either know someone in their family or in their extended family or in their immediate orbit network who's lived through this and potentially lost loved ones during this crisis. And so, thank you for picking that image. That one is obviously a favorite. Not all of these stories are happy. And I think that's whenever people see the cover of the book, they kind of think it's going to be like comic-y and lighthearted and funny and fun. But we've really kind of commandeered the medium to highlight the complexity of healthcare. And healthcare is not for the faint of heart, not all situations are happy situations. And we really wanted to bring that out. So thank you to Cody for not being afraid to go to a dark place in that particular story.
Before we sign off, we want to remind you, whether you're a student, a practitioner, or educator, the work you do is important and can be stressful, but you are not alone. Please take care of yourself. Let's look out for each other, and we hope you join us again soon.
Thank you for joining us for part 1 of our conversation with Dr. Joseph Zorek. Be sure to catch part 2, where we'll discuss how visual storytelling shapes interprofessional learning and dive into some case studies straight from his book.
If you enjoyed today's episode and believe in the power of collaborative practice, hit that like button, subscribe to the podcast, and share it with someone who'd love it too. Let's grow this community of change makers in healthcare and education.